So the next measurement we're going to take is elbow flexion as well as elbow extension. For the axis of rotation, we're going to get this guy lined up to the lateral epicondyle of the humerus. For our stationary arm, we're going to line it up bisecting the acromion. You can kind of follow just the humerus here and split the shoulder. And for our moving arm, we're going to actually line it up with the radial styloid process. Just down here, you'll palpate towards the wrist and you'll find a bony prominence here, just distal on the radius bone, and that'll be thumb side. And so you'll line the movement arm with that guy. So here, lateral epicondyle, bisect the acromion, and then this guy is going to follow the radial styloid process. In this instance, we'll ask our patient to make the motion as if they're curling a weight. And so we'll go all the way up. We'll find that radial styloid, split that, and it looks like that gives us a measurement of about 141 degrees. Relatively, normals between 140, 150. That'll change based on the individual. It'll be useful to compare the right side with the left side just to see what their normal is. And then for the elbow extension, we're going to use the same landmarks. So lateral epicondyle, bisect the acromion, and use the radial styloid for the movement arm. We'll have them go all the way back without causing any pain or discomfort. Here typically you'll see 0, but some people do have some hypermobility, and you'll see like 1 to 5 degrees of hyperextension here. And so in this case, we'll find the radial styloid again. It looks like we do have about 2 or 3 degrees of hyperextension here, but that's how you measure elbow flexion and elbow extension.